Thank you. Can be seated, please. Your Excellency, Alhaji Abubakar Sani Bello, FNIM, Governor Niger State and Chairman, North Central Governors Forum, and inshallah, the distinguished senator representing Niger North Senatorial Zone in the red chambers of the National Assembly COM 2023. Can you please put hands together for him? Your Excellency, Alhaji Ahmed Mohamed Kesso, Deputy Governor, Niger State and Chairman, Niger State Primary Healthcare Development Agency Board. You're most welcome, sir. The Honorable Minister of Health, Dr. Osage Ohanire, ably represented here today by Dr. Usman Abubakar, Chief Medical Director of Federal Medical Center, PIDA. You're most welcome, sir. The host commissioner, the Honorable Commissioner of Health, Niger State, Dr. Mohammed Makusidi, and other honorable commissioners here present, you're most welcome. The Secretary to the Niger State Government, Alhaji Ahmed Ibrahim Matane, the Head of Service, Haja Salama Titi Abubakar MNI, the Chief of Staff, Honorable Ibrahim Balarabi, Satrakin Kagara, members of the Niger State Security Council here present, our very distinguished Royal Father of today, His Royal Highness Alhaji Dr. Umar Farouk Bahago, Silwen, Ene of Mina, ably represented here by the Mabudin Mina, Alhaji Abubakar Yakubu Boso, Special Advisors to His Excellency here present, the Executive Director, Niger State Primary Healthcare Development Agency, the host Permanent Secretary, the Permanent Secretary, Minister of Health, and other Permanent Secretaries here present, Directors General, Heads of Federal and State Agencies and Parastatals here present, the National Coordinator, National Malaria Elimination Program, Dr. Perpetua Ohomoebi, ably represented by Dr. Okefu Okoko. You're most welcome, sir. The Country Coordinating Mechanism for Global Fund Nigeria, Tajuddin Ibrahim, Dr. Jennifer Ayanti, Deputy Managing Director, Society for Family Health, SFH, Director General, Director Global Fund Malaria Project, Dr. Enes Uwokolo, representative of the Catholic Relief Services and other partners here present, district heads here present, students of health institutions present, distinguished invited guests, members of the press, ladies and gentlemen. Your Excellency, distinguished ladies and gentlemen, we'd like to welcome you to this official flag-off ceremony for the distribution of insecticide-treated nets, ITNS, and Scales 3.0 COVID-19 vaccination in Niger State by the Niger State Ministry of Health in collaboration with the Federal Ministry of Health through the National Malaria Elimination Programs, Society for Family Health, and other malaria partners. Your Excellency, sir, malaria has continued to be a serious health challenge despite being a preventable and treatable disease. It has, however, been proven that the use of insecticide-treated nets is the most effective and the most widely used intervention for malaria control in Niger State and in Nigeria. and this has effectively reduced malaria, morbidity, and mortality. We'd like to humbly to help us give thanks to Almighty Allah for letting us have this day today. We humbly invite the Honorable Commissioner for Water Resources, Malam Yusuf Suleiman, and from the State Primary Healthcare Development Agency, Mrs. Victoria Ajayi, for the open prayers.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Let's recite Surah Al-Fatiha. May Allah make this program succeed for the benefit is made for. Alhamdulillah Rabbil Alameen, Ar-Rahman Ar-Rahim, Maliki Yawmiddin, Iyaka na'budu wa iyaka nasta'in, ihdina as-sirata al-mustaqim, sirata alladhina an'amta alayhim, ghayril maghdubi alayhim waladdallin. Amin. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. ربنا تقبل منا إنك أنت السميع الدعاء. لا حول ولا قوة إلا بالله العلي العظيم.
Our Father and our God, we thank you, we bless your name for this program. And I will pray that as you are picking up with the Rotavirus vaccine and other vaccines and the next, it will be of usefulness to our community and to our people in Jesus' name. But I give us peace and direct us in this program today. Make it a success. In Jesus' name.
Thank you so much. Your Excellency, with the fourth wave of COVID-19 gradually sweeping across our country, His Excellency the Governor of Niger State will also be launching the optimized service delivery, communication, accountability, logistics, electronic reporting, and supportive supervision, which is popularly known by the acronym SKILLS, for the ongoing COVID-19 vaccination. SKILLS 3.0 vaccination campaign to further prevent our citizens against COVID-19 pandemic by aggressively increasing the vaccination process through various and newly introduced strategies. We all know the commitment of His Excellency in the fight against COVID-19, while other states are seeing it as a farce. His Excellency has continued to support the fight against COVID-19. Can we please put our hands together for him? To formally welcome us to this event, we'd like to humbly invite the Honorable Commissioner for Health, Niger State, Dr. Mohammed Makusidi, for his welcome address. Honorable Commissioner, sir.
Thank you very much.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Your Excellency, Dr. Professor Abubakar Sani Bello, Your Excellency, the Deputy Governor of Niger State and Chairman of Niger State Primary Healthcare Development Agency, the Honorable members of the Niger State Executive Council here present, Honorable Minister of Health, Professor Honorary, heavily represented by the Medical Director, Federal Medical Center, Peter Dr. Usman Abubakar, the SSG, Chief of Staff, Head of Service, practitioner and religious leaders here present, development partners, World Health Organization, SFH, Chemonics, CS, members of the health sector family here present, members of the press and security outfits here, ladies and gentlemen, good morning. I'm highly delighted, I'm so honored that His Excellency Dr. Abubakar Sani Bello has always been fulfilling the promises made to the teeming residents of Niger State, especially as it relates to the health sector. And as we do say, there is second to none in Niger State as far as attention of His Excellency and this government is concerned, other than the Minister of Health. And we said Minister of Health is second to Government House. Mr. Governor made it clear yesterday, just at last minute information, that he's going to be here, and he's here. I think His Excellency deserves a standing ovation. Malaria remains a major public health challenge in Nigeria, and Niger State not exempted. It constitutes a huge epidemiological burden in our society and continues to cripple the economy of the nation, and Niger State is already a non-leading cause of morbidity and mortality in our setting. The figures cannot be quantified, but it's huge, constituting the large reason why people attend to our facilities. This particular flag-off is a unique demonstration of the government, as usual, in our resolve to pursue prudent utilization of available resources. We will witness the flag-off of the replacement of 3.7 million lakes insecticide treated across the 25 local governments. Also, the Scales 3.0 initiative, which is an approach to scale up COVID-19 uptake, Rotavirus vaccine, and the inauguration of the revitalized primary care task force for immunization, which is going to be done by His Excellency Dr. Abubakar Sani Bello shortly. Under the leadership of Dr. Abubakar Sani Bello, a lot of achievements have been recorded in the health sector, including what we are witnessing today. Malaria constitutes a burden of almost 70–80%, but during the regime of Dr. Abubakar Sani Bello, it will reduce to 33%. Among other achievements in the health sector, the pillars in the health sector include governance, healthcare financing, human resource for health, infrastructure development. Believe you me, since the creation of Niger State in 1976, we have not witnessed a tremendous overhaul of the sector like we are witnessing now. In terms of governance, it has never been in the history of Niger State where a high-level representation is made, where the Deputy Governor of Niger State is the chairman of the Niger State Primary Care Development Agency. His Excellency Dr. Abubakar Sani Bello also goes for first-hand information search in terms of monitoring and supervision at odd hours, 2 a.m., 3 a.m. And in fact, on his arrival this morning, he has already made an observation in this facility that he visits at odd hours and observe that there is issue of electricity supply here. So were it not because of his commitment and passion, I wouldn't think the achievements we have recorded will have been as they are today. In the healthcare financing, we all witness that the catastrophic expenditure that we do observe in seeking for healthcare services, this regime has established and functionalized what is called NACIA, that is healthcare insurance scheme in Niger State, and it's already operational. We also advise people to go and register. In terms of infrastructure, the dilapidation has been so long ongoing, and then of course we can't do it in a single leap. Thus, with focus and criteria, I'm sure a lot of infrastructure development has been ongoing from primary healthcare level to the tertiary. everybody that goes to Kwantagora General Hospital Mina, General Hospital Suleja, and Tungamagajia, you will note that there are ongoing activities there in overhauling these structures. For others that have not been yet touched, these are due to so many competing demands, and we cannot take all of them at a time. But we have faced them, so we are telling the public that none is forgotten, and we are going to approach them as at when due. So it's not that they have been left behind. Your Excellency, sir, we are happy to announce to you that Dr. Amina Abubakar, who is also a senior colleague consultant gynecology, is not left out in making sure that healthcare services to the teaching residents of Niger State is given the right approach it should be. Her Excellency do go to our hospital, Jumai Babangida operates, run clinic, and also perform surgeries without a dime being paid to her from Niger State government. Foundation, God's Race Foundation, where we do medical outreaches, a lot of millions of naira has been spent on Niger Lights, especially for those that cannot afford, and they are being assisted locally and internationally. The purpose of this year's long-lasting insecticide replacements campaign are to distribute 3,760,000 long-life insecticide nets in the states through mass campaign starting from today, 1st of September 2022. And this is going to run across the 25 LTAs, the 274 wards in the state. To reduce the malaria burden to pre-elimination level and bring malaria-related mortality to zero. The activity being flagged off today is being done by the states and supports by the government of Nigeria and partners, as I mentioned earlier. Your Excellency, sir, ladies and gentlemen, at this juncture, I want to recognize and appreciate the effort of our supporting partners who have been on ground in efforts aimed at reducing the burden of malaria and other diseases in the states, and to strengthen the primary healthcare system in Niger State. This note, I welcome you all to this event, and God bless.
Thank you so much, Honorable Commissioner for Health, Dr. Mohammed Makosidi. Can you please give him another big round of applause? Thank you so much. Your Excellency, we have a lot of partners here today who have indicated giving good messages, but there will be no time. So we're just taking two of them. And the first will be World Health Organization. Can you please come up? Let's know your name. And you have just 2 minutes for the goodwill message. After which, Society for Family Health, also 2 minutes. You give us a name and you have 2 minutes to give your goodwill. Thank you.
Because of the time factor that the MC has just mentioned, I would like to stand on the existing protocol to be able to save the time. My name is Pharmacist Abdullahi Sani Galadima, Public Health Officer of World Health Organization. I'm here to represent my state coordinator, who is unavoidably absent, by name Dr. Hamisu Al-Hassan Dama. We want to congratulate Niger State government for this good initiative of trying as much as possible to integrate 3 things at a time. What we are doing here today is flagging of the insecticide net, flag of Rotavirus, and flag of COVID-19 vaccination. If you look at 2 out of these, has direct bearing with our children and our future. So I want to congratulate you on this, and for the COVID, we are flagging up scale 3 as into the first and second has not really been able to take us to the level we expect. So we want to create the indulgence of the state government to support partners on the ground and see to make the scale up 3 for COVID a success within a very short time. Yes, we can do it, Niger State can do it. I wish us the best of luck. Thank you.
Thank you so much. Your Excellency, next we have SFH. I've just been told that there is a partner that is responsible for sourcing the money, which I didn't call. So if we don't allow them to say thank you or to appreciate His Excellency to do bad, maybe they will stop sourcing the money for us. So a beggar has no choice. So let me allow them for just 1 minute. So SFH, after which CRS.
His Excellency, the Executive Governor of Niger State and the Chairperson of the North Central Governors Forum, and Dr. Abubakar Sani Bello, I'd like to stand on the existing protocols to save time. I'd like to, on behalf of the Board and Management of Society for Family Health, thank the Governor, especially his whole cabinet, and the people of Niger State for their support towards the flag off of 3 different areas. But for Society for Family Health, we're specifically on the flag off of the long-lasting insecticide-treated nets for 2022. I'd like to also bring to the notice of the Governor that this is actually the 4th campaign that Niger State has been taking part in, and to congratulate him on this being the 2nd one during his tenure as Governor. So we have done net campaigns in this state in 2009, 2014, and then 2019 and 2022. So I'd like to congratulate the Governor and the people of the state on this. And this shows his keen interest in the health of the people of Niger State. So please, a round of applause to him concerning this. I'd like to say that Society for Family Health is gratified to be here. We're also very happy that we have been chosen continually to do these campaigns. Like I've said, we've actually done 4 in this particular state. I'd like to encourage the people that they will notice that the Governor will be here. The Governor is here. How importantly he takes it is likely to sleep under the net. And so just like that, the people should take this seriously as we continue to impact on malaria in the state. I'd also like to take this opportunity quickly to recognize the Global Fund and the country coordinating mechanism. Thank you very much for your support, as well as also to recognize Catholic Relief Services, who are our principal recipients here. So once again, a very warm thank you, congratulations to the people of the state, of course represented very much by the Executive Governor, and we look forward to a wonderful occasion. Thank you very much.
Thank you. I gave you 1 minute, you took 1 minute, 27 seconds. Please keep to time. Catholic Relief Services representative, please, just 1 minute.
Permit me to stand on the existing protocol. My name is Emmanuel Abu from Catholic Relief Services. I bring you greetings from the staff and management of Catholic Relief Services in Nigeria. CRS, as it's usually called, is an international organization with a 78 years history and 25 years history in Nigeria. Currently, we are the co-principal recipient of the Global Fund Malaria Project, along with NMAP. So the Global Fund Malaria Project, the goal is to eliminate malaria and fight it to a standstill. For CRS, we're actually supporting the technological aspects. And as a matter of fact, currently, we have actually deployed over 2,500 devices on the field to aid in the distribution of the ITN. So generally, our role is to support the distribution through technology. And I'd like to congratulate the Executive Governor of Niger State and the good people of Niger State on this historic flag off. And we actually wish everyone a seamless and a peaceful distribution of the ITN campaign. Thank you.
Thank you so much. Please put your hands for him. Another one, it really came to time. Thank you so much. Your Excellency, we'd like to at this time invite the National Coordinator, Dr. Perpetua Ohumoibi, who is ably represented by Dr. Okefu Okoko for his address.
Your Excellency, the Executive Governor of Niger State, and permit me to stand up for the existing protocol. I want to particularly appreciate Your Excellency for granting us audience yesterday when we visited you at the Government House. And thank you for all the promises and assurances you gave us in this fight against malaria. ITN campaigns have been happening in Nigeria over a number of years now. We started in 2009 and have run several cycles. Niger State happens to be one state that has not missed any cycle since the inception of campaign procedure. So I want us to give Niger State a round of applause. And we want to also thank the Executive Governor and his amiable wife for accepting to be the net ambassador for Niger State in the fight against malaria. Her outstanding qualities have already been mentioned in one of the speeches, and we cannot but appreciate the fact that somebody like her will be leading this battle and encouraging the masses to utilize malaria prevention services and treatment services as well. One thing that we want to leave with the state on this very important day is that 3.7 million nets will be distributed across all the 25 LGAs in the state. But we don't want it to be just a receiving of nets. We want to encourage the state and everyone in the state to sleep inside their net every night. In this way, we are able to bring down the malaria prevalence that has not been very cheering as far as Niger State is concerned. We want to thank you for all the support we've received at the traditional level. The traditional council are here and they've given us support as we went across the different states. We thank you for your audience and we say God bless Nigeria.
Thank you so much, Your Excellency. We now like to take a 1-minute demonstration. It's one thing to build the nets, and it's another thing to use them properly. Just like my brother Fuladima was giving the net, and at night, when the mosquito came, he decided to direct the mosquito to the mosquito net, because that is his net. So it's not a mosquito, so it should not sleep in the mosquito net. So how do we use this net effectively? We'd like to invite the health educator for just 1 minute. Practical demonstration of how to use the net.
Assalamu alaikum wa rahmatullahi wa barakatuh. Your Excellency, the Executive Governor of Niger State, Alhaji Dr. Abubakar Sani Bello, permit me to stand on the existing protocol. My name is Mohammed Alhaji Usman. I'm the State Education Officer. I'm to take you the audience through on the importance of demonstration of hand of net, how people to use net in the state. Now it's very key and paramount. Okay. Now I think I will use English so that my LGA educator will translate it to Hausa language in 1 minute. Okay. Demonstration na wannan gidan soro. Aka baka gidan soro zaka iya rike shi inuwa na 24 hours. A 24 hours din kuma zai zamanto ba za a yi authority din shi ba, zai zamanto ne sai ya kai 24 hours din kafin a sa shi daidai inda za a yi amfani da shi a wajen gado ko mattress ko tabarma abin da ya sawaka. Dan da dare in za ka kwanta a cikin gidan sauro, kuma ka tabbatar ka yi stocking din shi inda mosquito ba su samu da za su yi bleeding su shiga ciki ba. Dan kuma in gare waye ka tashi za ka yi abin da za ka ɗan 40 din shi, ka yi 40 din gidan sauron inda za ka yi abin da ko ka cire shi a kan gadon inda yara ba su samu su yi wasa da shi ba. Dan in yayi datti za a cire shi a wanki, a sa shi kuma a set wanda mutane rana ba zai samu ya yi reflecting a kan gidan sauron ba. Dan na ƙarshe in yi yage shi za a dinka da zare da alura wanda zai kasance ba bukata inda sauro zai shiga ya cije mutum da dare. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much. Thank you. And you scored P7 in that house. P7. Or is this F9? Okay, P7. All right, clap for him, clap for him. No, clap, P7 clap, not A1 clap. P7 clap, clap for him. Thank you. Thank you. But the message was sent. Thank you so much. Your Excellency, we now like to go on straight to presentation of award to ambassadors and next advocates by the Society of Family Health. I've just been told that thank you. I've told you at times, I didn't see anything and the microphone was calling a different thing. I've decided to correct it, which is ably represented here today by Dr. Usman Abubakar, who is the Federal Medical Center bidder, for his address. Honorable Minister, sir.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Your Excellency, the Executive Governor of Niger State, Governor Abubakar Sani Bello, permit me to stand on the already established protocol. My name is Dr. Abubakar Usman, Medical Director of Federal Medical Center, BIDA. I'm here representing my Minister of Health, who is unavailably absent. My work has been made easy because he has sent a prepared speech, which I will only read. And as an obedient servant, I'll try as much as possible not to alter anything in the speech. It is with a great sense of responsibility and honor for me to be part of this auspicious occasion of the flag-off ceremony for the mass stroke replacement campaign and distribution of insecticide-treated nets to the people of Niger State. Let me at this stage acknowledge His Excellency, the Executive Governor of Niger State, Abubakar Sani Bello, and his amiable wife, Her Excellency
Dr. Amina Abubakar Bello, for your esteemed presence at this occasion. I'm also pleased to inform you that the use of ITNs has been one of the key strategies adopted for the prevention and elimination of malaria in the country by the federal government and Niger State. And Niger State is one of the 7 states to benefit from this intervention in 2022. The other states are Delta, Yobe, Kaduna, Taraba, Kano, and Anambra states. 3.7 million ITNs will be distributed with support from the Global Fund through Society for Family Health as the implementing partner in this 2022 ITN mass campaign. Meanwhile, Catholic Relief Services, CRS, a principal recipient on the grant, will provide both oversight and operationalize the deployment of technology during the exercise. I'm pleased to inform you that the Federal Ministry of Health, in collaboration with Niger State government and the Rollback Malaria Partnership in the state, have ensured that proper and adequate planning has been done to achieve a successful ITN mass campaign in the state. As part of the planning process for the campaign, series of meetings have taken place, including the engagement with all stakeholders in the state. The highlight of these activities was the acceptance of Her Excellency, the First Lady of Niger State, Dr. Amina Abubakar Bello, as the net ambassador of the state. Can we please give her recognition? This laudable gesture will greatly promote the proper use of ITNs and the utilization of other health interventions among the people of Niger State. The 2021 World Malaria Report has presented a gloomy picture of Nigeria malaria elimination effort, and she is presently adjudged to be off track towards the attainment of global technical strategy between 2016 and 2030 targets of reducing malaria deaths and disease by at least 40%. Despite these challenges, the report has also provided suggestions on what is needed to get us back on track, as well as improve on the global malaria response. Even with this unpleasant report, we are still resolute in our quest for a malaria-free Nigeria. Hence, the need to implement ITN mass campaigns in the context of COVID-19 pandemic. Permit me to use this opportunity to urge the states to take leadership and ownership of this process to ensure sustainability and lead to the elimination of malaria. I appeal to our traditional and religious leaders to assist in encouraging people in our communities to sleep inside the net every night. Let me also use this opportunity to appreciate the support of the Global Fund, the Catholic Relief Services, Management Sciences for Health, Society for Family Health, the World Health Organization, and the Rollback Malaria Partnership for the great support received from them towards elimination of malaria in the country. I call on the gentlemen of the press to support this process by disseminating malaria message to every nook and cranny of the state, especially the information on hanging and sleeping inside the nets, the intermittent preventive treatment for pregnant women, and the utilization of other health interventions for malaria prevention. I am confident that if we are committed in all our efforts, we can join hands to eliminate malaria in the continent of Africa and indeed Nigeria to achieve a malaria-free Niger State and a malaria-free Nigeria.
let's all stand up and take action. Thank you, and God bless you all.
Thank you so much, Honorable Minister. Can we please put our hands together for him once again? Thank you so much. Our very distinguished guests, next we're going to have His Excellency and if you see in your program, it is a lengthy task for His Excellency. We can see that there's a lot of task to be done by His Excellency. He's going to deliver a speech after which we'll be inaugurating the Primary Health Care Task Force Committee. They will all stand when it gets to the time to be inaugurated. After which there will be official handover of campaign ITNs to His Excellency by the SFH and the Honorable Commissioner for Health. And then we're also going to see His Excellency sleep. I would say sleep, lie down. Inside the nets, you can see it here. And then we have the symbolic distribution of ITNs to beneficiaries to be led by His Excellency, and then the launch of the Rotavirus vaccine before he takes leave and then goes back to his seat. So once again, let me humbly invite His Excellency, the Governor of Niger State, for his address.
Bismillahirrahmanirrahim. Your Excellency, the Deputy Governor of Niger State, Chief of Minister of Health, members of SSG, Head of Service, Chief of Staff, Special Advisors and Permanent Secretaries present here today, the National Coordinator, Malaria Elimination Program, represented by Dr. Ekefu Okeke, all other partners from World Health Organization and other donor organizations present here today, Local Government Council Chairman, the Royal Highness Emir of Mina, ably represented by Alhaji Abubakar Bosu, Mabudi Mina. Distinguished invited guests, ladies and gentlemen, I am glad to join you here for the flag-off ceremony of mass distribution of insecticide-treated nets, scale 3.0 COVID-19 strategy, and rollout of rotavirus vaccine. I am delighted that these health interventions are coming at a time that we need to change the narrative of the healthcare indices for the improved healthcare of the people. I am confident that these interventions will significantly improve the quality of life of our people, especially the vulnerable women and children. Rollback malaria and immunization are cardinal areas that require a new wave of sensitization for the people especially women, to reinforce the practices that in turn will lead to quality life. This will also serve as an impetus for the existing healthcare programs that are geared towards reduction of child and maternal mortalities. The Honorable Commissioner of Health has briefed me that the prevalence of malaria in Niger State is gradually reducing. Additionally, vaccines for COVID-19, including the one to protect our children, are now available. So please find time to take your children to any of our primary healthcare centers so they can get vaccinated. This is a statement of a huge investment and commitments we have put into the healthcare delivery in the state over the years. We are committed to carrying out cost-effective interventions such as the large-scale distribution of long-lasting insecticidal nets to safeguard the life of the people. Let me therefore reiterate my directive that every life in the state must be accounted for and every death should be investigated. Not just the ones caused by malaria, every death should be investigated. You have the ones caused by malaria, you have the ones caused by negligence, and you have the ones caused by human error. And just yesterday I directed the Ministry of Health through the various agencies, they should go around the state and close down all quack clinics and hospitals within the state. They are responsible to carrying out surgeries that in the first place they shouldn't. They do not have the manpower or the capacity or the equipment to carry out such surgeries. So I've mandated the Commissioner of Health and his team to take a few weeks, go around and close down all quack clinics and medical facilities within the state. In the area of manpower for health, we have established the new health institutions and increased the capacity of the existing ones to meet the increasing manpower needs. Our state primary healthcare development agency has been strengthened and currently one of the best in the country. All of these we are doing to ensure that all residents in Niger State have access to qualitative and affordable healthcare services at all levels. Therefore, I urge Nigerians to collect and properly use the insecticide nets so that together we can significantly reduce the menace of malaria. They are safe and free. Furthermore, I want to also remind Nigerians that menace of COVID-19 disease is still with us. It is for this reason that the national and state governments are revamping the COVID-19 vaccinations to build a resilient society to forestall against further outbreaks. The SCALES 3.0 initiative is an innovation designed to increase an uptake of COVID-19 vaccinations across the state. The State Primary Healthcare Development Agency, in partnership with other stakeholders, has deployed additional team and resources to render COVID-19 vaccinations and other integrated PHC services to underserved, densely populated, and difficult to reach areas across the state. Similarly, the rotavirus vaccine is being introduced into the national immunization schedule. This is because there is scientific evidence proving that rotavirus is the leading cause of diarrhea in children under 5 years of age. Therefore, after today's launch, the vaccines will be available in all our health facilities offering routine immunization. I urge you all to embrace the vaccine as they are safe, free, and effective in protecting children against diarrhea. Finally, in an effort to reposition effective monitoring and supervision of immunization and other PHC services in the state, I am today inaugurating State PHC Task Force formerly known as State Immunization Task Force. The task force draws experienced membership from both government and partners and is chaired by the Deputy Governor. I therefore call on all members to bring their expertise to bear so that the task force shall succeed in achieving its terms of reference. At this juncture, it is my singular honor to flag off the mass distribution of insecticide-treated nets, the Skills 3.0 COVID-19 vaccination strategy, and the launch of the Rotavirus vaccine in Niger State to the glory of Almighty God and the benefit of mankind. I thank you all and God bless.
A symbolic presentation.
Your Excellency, sir, at this point, the MD Society for Family Health is handing over the nets. We have 3.7 million nets that have been brought into Niger, and they will be distributed in all 274 wards in the state. Your Excellency, sir, apart from getting the nets, we have divided the state into 1,395 distribution hubs. And at this point, Your Excellency is going to distribute the net to families. Families already have been mobilized. We have the first household that is taking the net. Is Safia Suleiman. Safia Suleiman. Where's Safia Suleiman? Safia Suleiman. The next person is Safia Please, can we give His Excellency space so that the Excellency can sit inside the bed? Please, hello. The Excellency, sir. He's at the back. Thank you, Your Excellency, sir. Okay, can we give space to the defense? The Excellency will demonstrate the safety of the dead. Thank you, Your Excellency. Thank you very much. Now, when we get the dead, remember what we say. Play it for 24 hours. Then we can put our space.